What is Botox? Why should you use it?
We all love it. Where do you put it? How does it work? What could go right?
What could go wrong? This is Med Spa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate D. Together, we explore the wild west of medicine that is the aesthetics industry. In this episode, we are talking all about Botox, Dysport, and the other neurotoxins that are used to treat wrinkles. What are they great for and what can go wrong? Along with all the ways that people are cutting corners to make a buck off the exploding demand for these toxins. Would it surprise you that much of this part of the industry is totally illegal? If you've ever had Botox or are thinking about it, listen on to get the inside scoop. Hi, Judy. Welcome back. Thanks for coming back.
Thanks for having me.
Today, we're going to talk about Botox or toxin, what can go wrong. For everybody out there in the audience, we talk about Botox and toxin interchangeably. There are actually 5 neurotoxins that are FDA approved in the United States. They're Botox, Dysport, Xeomin, Juvo, Daxi. They all basically work the same way and have the same active ingredient. So today we're going to talk about what's great about them, what's not so great about them, what complications can happen, and then who can inject and what can go wrong. So let's start. What is a toxin?
The toxins come from botulism or botulinum toxin, and it is isolated and then usually connected to a protein. And the concentration of the toxin is extremely small when you compare it to the amount of toxin someone would get if they had botulism.
Right. So botulism is a poisoning. It can kill you. It basically paralyzes and you die pretty quickly. So with toxin, we are using teeny tiny little amounts in order to paralyze certain muscles to treat certain wrinkles. Okay. It can't be used for every wrinkle in your body, but very specific ones. And the way it works is that toxin goes in and binds to a little protein at the neuromuscular junction where the nerve connects with the muscle. And it completely blocks that connection. And if you block enough of the connections between the nerve and the muscle becomes paralyzed temporarily. Once the nerve ending connection is broken, that one is permanently gone. But what happens is your body sends out new little connections that connect over time. And somewhere around 3 to 4 months later, there are enough connections that have reformed that muscle starts working again. So that's how neurotoxin works. And as you hear us talk about Botox, toxins, neurotoxin, just keep in mind they're all basically the same. So what wrinkles do you treat routinely with toxin in your practice?
Lots of different wrinkles. Everyone loves Botox. So you can treat the number 11s, which we call the glabella, or you can also treat the forehead wrinkles, which are the elevators of the forehead. We can treat the crow's feet. The neck has little bands in it called platysmal bands, and we can treat those as well. We can use it for TMJ and place Botox into the masseter muscle and the jaw. I also use it for people who have excessive sweating. It's called hyperhidrosis, and we'll put 50 units of toxin into each armpit.
And you can also treat palms as well. I've done palms.
You've done palms.
I have. It's not the most pleasant thing to receive, but it works incredibly well. It also is used to treat headaches. And a few other wrinkles we didn't mention, the bunny lines. Lots of people don't have bunny lines, but if you make kind of a frowny face. A lot of times people have these lines in their nose that make them look like a bunny, and those are actually really easy to treat. And the other thing is when a lot of people have downturning of the corner of their mouths, otherwise known as resting
DAO.
Bitch face. And there we can treat the muscle that tugs down on the corner of the mouth and make that more even so you don't have that resting look. What about other areas in the lower face? There are a few more areas in the lower face that are a little more risky to do. Thinking about the chin, sometimes if the chin, you can treat if there's that pebbly chin or peau d'orange where it looks indented and people don't like that. You can treat the chin muscle and that goes away. You just have to be really, really careful about your placement to make sure that you don't get any of the other little muscles in the lower face, because you can end up with an uneven smile or uneven face.
The number one thing that people search for in terms of toxin on my website, believe it or not, is pebbly chin, by far.
That's so interesting.
Isn't that interesting?
I would say the number one place that we put it is in the 11s, those vertical lines between your eyebrows, because the only thing that those lines ever convey is anger or concern, and getting rid of that expression only makes you look happier and nicer. When I first started doing Botox back 10 years ago, the first person saw me and said, "Wow, Kate, you look so much less angry." And that really kind of pissed me off. But anyway, yeah, that's a really great use of it. And the other interesting thing is that I'm not a big headache person. I don't have migraines. But when I do get a headache, I know that the toxin has worn off and I'm due. That's the only time I ever get headaches now. Whereas before I used to get, tension headaches after a very long, stressful day.
Yeah, lots of patients come into the office and, we treat them with toxin for their number 11s and their forehead wrinkles, and they tell us that their headaches go away.
Yeah. So those are all that's a great list. I mean, we could talk for a really long time about all the benefits of Botox. But let's talk about what can go wrong. So first of all, there's kind of two different categories of things that can go wrong. There's the you look bad going wrong, like it was placed wrong or it went somewhere it wasn't supposed to be. And then there's the danger to your health, and you can actually even die go wrong. So let's talk about those. So let's first talk about just unwanted outcomes of appearance.
Lots of different cosmetic things can go wrong, and usually you can fix it by injecting the opposing muscle, but you can get droopy eyebrows, and that's usually an indication that the patient's lost their elastin in their forehead and they're unable to support the skin from the forehead down to the eyes. But you also can have Spock eye if you inject too laterally.
I think not only that, but one of the things about forehead, I think the forehead is a very delicate area to inject, and everyone has a different opinion and desire about what they want their brows to do. And because the forehead muscles lift the brows up, and because the muscles around the eye, the orbicularis muscles, kind of pull down on the brows, that if you treat either of those muscles or both, it's going to change the shape of your brows. And some people have a really strong forehead muscle, and other people not so much. And it's quite an art to treat someone's forehead properly so that they look normal and don't have a weird eyebrow that's either too high or too low at the end.
Yeah, every patient's different.
Yeah.
And you have to assess every patient and change your technique for every single patient.
And a lot of new injectors, when you go to your first class on how to inject Botox, people are taught not to inject lateral to the mid-pupillary line. So where your pupil is on your eyeball, there's not supposed to go to the side of that. And the problem with that is that some people have really strong muscles out there. And if you don't put any toxin out there, they're going to get a Spock eyebrow. They're going to look like Mr. Spock from Star Trek. Other people, they don't have a strong muscle out there. And so you can get away with not injecting anything out there and they look perfectly great. So that's part of the art of knowing what you're doing and injecting Botox. But if you put way too much out there, you can get a droopy eyebrow, especially for those of us who are maybe a little bit older. and we already have a little bit heavy lipped, and we really need those forehead muscles to keep our brows up and our eyes open. So that's kind of a big one, is the droopy eyebrow. What about droopy eyelid? That's a whole different thing. Well, there's also the little tiny muscle in your eyelid, the levator palpebrae, that generally we don't touch. We don't go anywhere near that muscle. But if you inject too deeply, and the toxin actually gets access to that muscle, the eyelid itself can end up at half mast. You can no longer really open your eyelid. Well, so that will happen. That happens pretty commonly, actually. So not common meaning, every day. But I would say that I've seen that in my clinic about once a year. But we have, 4 injectors who are very busy. And I did have one person I tried to train once who, for the life of her, could not get past. I mean, she could not inject somebody without dropping their eyelid. She did not work out, so she did not get a job. But
what do you do if someone has dropped their eyelid because
their
levator was injected?
So it's very rare. And so what happens with that is that if that were to happen, usually it's because a tiny bit of toxin percolated down into the levator and was affecting it. Typically, the effect only happens for a few weeks. And the one thing now, we have Upneek in our office that you can use Upneek, and that for the most part can reverse that. Mm-hmm. So that's a drop you have to put in every day, but that can lift the eyelid back up. We really, luckily don't have to do that very often, but that is a known complication. And the only good thing about that is that there is something you can do about it, and it doesn't last very long, unlike the droopy eyebrow, which you just have to wait for it to go away. There's also getting an uneven smile. If you were to put toxin in any of the muscles of the lower face in the wrong amount in the wrong place, you can end up with a really uneven smile. One corner of your mouth goes up when you smile and the other one doesn't. And that, I've very, very rarely ever seen that, but that can happen if you were to venture into the lower face, which is why we really don't tend to do that very much.
Yeah, except for pebbly chin.
Except for pebbly chin, which is generally pretty easy. It doesn't take a lot, so that's convenient. Yeah. I have seen somebody who had trouble swallowing. This was not someone who was treated in my office, but she went to the East Coast and someone put 100 units of toxin in her neck. And she had trouble swallowing when she came home back here to the West Coast. Yeah.
Too much Botox can cause paralysis.
Yeah.
And I had a patient many years ago in my San Diego office who I was on call. So I was rotating the calls and admissions to the hospital, and she was admitted to my service. She had purchased Botox online and injected herself with 300 units in total in her face and in her neck, and she ended up with complete respiratory paralysis and on a ventilator.
Did she survive?
She did, because she was on a ventilator, but she was in the ICU for a month.
Oh my God. And she did that to herself?
She did that to herself, and she had no training whatsoever. She watched some videos, and she was going for a job interview at the hospital that I admitted her to. And she injected herself without any knowledge, because she could buy the Botox, and she could have died if she was not, intubated, put on a respirator.
Wow, that is extreme. That's incredible. So she didn't get a job doing aesthetics.
No.
Okay. No. So she's not out there somewhere.
No.
Okay.
Not that I know of, but you never know.
Well, that brings up, how many units is too many? How many will you do in one day?
I won't do more than 100.
And 100's kind of a lot. Under what circumstances do you do 100?
If I'm treating someone's excessive sweating in their armpits. But if they ask to have their face done on the same day, the answer is no.
Right.
Because there have been many cases, or multiple cases, I should say, of patients who were given Botox correctly, who had systemic side effects and ended up with paralysis.
Do you have examples of cases? I only know of one. It was someone who was a scientist. I think he was a chemist of some kind. And this was soon after Botox was FDA approved back in 2003, and he didn't want to pay. It was very expensive. It's very expensive still. He didn't want to pay for that, so he decided he was going to purify it himself, and he injected himself and his wife and a friend and his wife, and I think they all ended up on a ventilator.
Yeah.
So folks, don't do this at home. That's the bottom line with that.
And there's a case in the literature, because I'm a nerd, so I'm always in PubMed, which is the National Library of Medicine, National Institutes of Health website. And there's a case of a patient who, in China, went to the physician, had Botox injected into her calves. She had 150 units, and she ended up on a respirator with paralysis.
Wow. Unbelievable. Well, I also, 100 is my max, and the only circumstance when I do that is for hyperhidrosis. Typically in the face, we're looking at doing anywhere from 20 to 60 units. Really, 60 is a lot.
Yeah.
So beware of someone offering to do multiple areas like that in one day.
Yeah, the other thing that people should know is that you can buy Botox illegally on the internet. And I read in the medical literature yesterday that the concentration of that Botox is greater than the concentration that you get when you buy it legally from the pharmaceutical company. And so there are higher instances of paralysis and droop and respiratory depression because the concentration is not what it should be.
Right. So it's really important to know that you're going to somebody who's legit and is not using fake toxin or illegal toxin imparted from China or getting it from the black market or using expired toxin that they got from someone else. There are also people who are just watering it down, which I don't know how that makes any sense, because if it's watered down and it doesn't really work, you're not going to go back there. But I suppose they can get you in for a Groupon or something, and then
always be wary of that.
Always be wary of that. So we're going to move on to a related topic, and that is who can inject Botox? What is legal? So obviously we know doctors can inject Botox. And because Botox is basically a drug, it has to be prescribed by a doctor or an NP or a PA in states where they have independent practice. Is there anybody else who can prescribe Botox?
Well, a dentist can prescribe Botox around the mouth.
Exactly. Okay. So yes, dentists in some states. I don't think that that's true in every state. I do know that in our state of Washington, dentists are allowed to use Botox around the mouth, but they're not allowed to go elsewhere in the body because that's not their area of specialty.
Right.
So what about RNs? Can RNs prescribe Botox?
They cannot prescribe Botox. Botox is a drug. It has to be prescribed by a provider who's a MD, DO, NP, or FNP, or ARNP. Sometimes the nurse practitioners are called ARNP.
Right.
But they can fulfill the prescription written by the provider who's legally allowed to prescribe.
Right. So registered nurses are allowed to inject Botox, but the prescription and the treatment plan has to be provided to them by a doctor or an NP or a PA in some states.
Who has to examine the patient.
Right. Who actually has to have examined the patient. So just because the RN is working for a doctor, but the doctor's never seen the patient, that does not mean that's okay. The doctor actually has to have a doctor-patient relationship with this patient, have done a good faith exam, and have prescribed Botox. Okay. So that's really important to cover because there are so many places doing this illegally. So who can't inject? I mean, basically everybody else. Okay, so chiropractors, estheticians, medical assistants, laser techs, random people off the street. No, those people cannot inject Botox.
Unless you're in Texas.
Unless you're in Texas. Right. And actually, I'm not sure. I think there's 2 states, but I'm not a lawyer. But I know that for sure in Texas is a very unusual state. And by Texas law, if an MD trains and oversees somebody else to do Botox, then they can do so legally under the doctor as long as they're actually trained and supervised by the doctor. So in Texas, other people, unlicensed people, can actually act like RNs in other states. In every other state, that would be completely illegal.
So in Texas, the plumber can do your Botox.
Exactly. The plumber can, the babysitter can, anybody who a doctor deems capable.
I want to see the bus driver to do my Botox.
Well, in actuality, in Texas, there are a lot of MAs and estheticians who inject Botox. And actually going to have a whole other episode talking a little bit about that at a future date. But in any event, in most states, that's not possible, okay, or not legal, all right? So what's the problem with any of that, okay? Like, what's the big deal if an RN goes ahead and treats you with Botox without a doctor?
Well, first, I think you have to ask the question, does the RN have a medical director who is supervising them? So if there is a complication, then the RN would go to their medical director. So the medical director has to actually know that they're the medical director, because there are instances where Botox clinics run by RNs will use someone's license and they don't even know it. But so if there's a complication, then you want to have a physician that you can go to who's going to help you with that complication.
Right. So one side of that coin is you really want to have someone to go to if you need them. Okay. The other side of the coin is if you have a complication and you're unhappy, then you have someone to sue if they're not helpful to you. And hopefully that person has medical malpractice insurance. If the RN is working without a doctor, do they have medical malpractice insurance?
I think RNs can buy medical malpractice insurance. It's a very small amount. So my RNs in my office have malpractice insurance, but it is a tiny, tiny bit.
Tiny bit. But they would not probably be covered at all
They would not.
if they were operating without a doctor, because that's not legal.
That's
right. So even if someone does, so I would venture to say most people doing this illegally probably don't have malpractice insurance, but if they do, they won't be covered if they're actually operating illegally. So that's not going to help you. Yeah. So if you do have a big claim, you're going to basically have to go after their house.
Correct.
Okay.
Correct.
So that's a problem. There's one problem. What about the fact that if they're really not working under a doctor, where are they getting the Botox?
Well, you can get it on the internet. Just Google, where do I buy Botox?
Right. So, and where's that coming from, though? Because you cannot legally get that in this country without going through the company that makes it.
Yeah. Lord knows where it's coming from or what's in it.
Right. So, I mean, there's definitely fake Botox that you can get from China. We just Googled that before we got on this podcast recording, and it's amazing how many websites there are where you can buy fake Botox. I don't know if you all remember about how there was fake dog food or dog food filler that killed all these dogs back in 2007. Do you remember that?
Yeah, my dog got sick.
So hard to, I mean, this is just incredible, right? So they were taking a material, melamine, which I know is built into shelving and is used as a fire retardant. And they were saying that that was wheat gluten and protein and putting it into this vegetable protein source that they were then selling to dog food makers in the US. Yes. All these dogs got sick and many died.
Yeah.
Yeah. So we don't know where this Botox is coming from, but you really don't want to take your chances with that.
Yeah. And you don't know what's in it.
Exactly. So no malpractice. I mean, there's really, I think that one of the things about it is when someone says to you, but I like my injector, I like the results. What do you say?
There's plenty of injectors who you will like the results as well, and they'll do it legally and with proper knowledge, and they can also follow you up if you have any complications. I mean, sometimes people go to Botox parties, they get injected by someone, they don't even know their name, they have no idea what their credentials are, and then they're gone.
Right, they're gone. And I can tell you that I know personally a couple of salons in my general area where they have someone come in around once a month and informally do Botox parties. My understanding is that the person who comes in is usually an injector who has a day job injecting, working for a doctor, and it's their night off. and they figure they'll make a little money on the side. And I will tell you, even though that person is probably very skilled, they can't buy Botox on their own. So probably they've taken it from their office that they work at. And they also would not be covered by the doctor's malpractice if they're doing a Botox party. They probably have not told the doctor who they're working for that they're doing it. Even if they did, the doctor probably doesn't realize that they wouldn't be covered if anything went wrong. So these Botox parties are really pretty dicey. So I think that's been a really great discussion about Botox and toxins in general. I think the main conclusion that I want to make sure everybody knows is toxin is awesome. We love it. We do it a ton. I do it for me.
I do it for me.
And our patients love it. And don't be too scared. But I think there are really some really important things to keep in mind. There are things that can go wrong, and there are places doing it very illegally, and there is a risk going to any of those. So I would highly recommend going to a reputable place where there's real doctors and there's real people who really care about doing the right thing.
I agree 100%.
If you have a question or a crazy story of your own that you'd like to hear on Med Spa Mayhem, contact us through our website, medspaamayhem.com, or check out our contact information in the liner notes. If you learned something today and like what we're doing, please give us a 5-star rating and read the book. Med Spa Mayhem is coming out June 11th, 2024. The link to pre-order is available on medspaamayhem.com. Dr. Judy Rubin, thanks again so much for co-hosting another episode of Med Spa Mayhem.
Thank you so much for having me.
What's the most important take home for our listeners?
I would say that we love Botox. It's a great medication, great treatment, but make sure that it is safe, prescribed by someone who has the license to prescribe. So a physician, a PA or FNP, and that it's real.
Damn it, Jim. I'm a doctor, not a lawyer. I do my best to research the legal aspects of med spa law, but wow, that's hard. The laws are different in every state. Just trying to figure out who can inject Botox in Texas hung me up for days, and I'm still not sure. If you have questions about what's legal in your state, please contact a healthcare attorney. If you ask Dr. Google, you'll find 5 different answers to every query. And here's a fact check of today's conversation with Dr. Judy Rubin. In fact, butchers are not allowed to inject Botox in Texas. Estheticians and medical assistants in Texas are indeed allowed to do so under a doctor's supervision. We could not figure out which states, if any, are like Texas in this aspect of the law. Also, in 2007, 4 people did in fact end up on respirators after being injected with Botox obtained for laboratory use and not for use in humans. The person doing the injecting was a doctor, not a chemist. He injected himself and 3 others. We could not confirm whether these patients were indeed his wife, friends, or patients from his clinic. This has been Med Spa Mayhem with Dr. Kate D. We are so grateful you are listening, and we hope you have learned at least one fun or possibly disturbing fact today. Don't forget to subscribe and leave us a 5-star review. Oh, and read the book. Med Spa Mayhem comes out June 2024, available everywhere books are sold. You can pre-order now on Amazon and Barnes & Noble, and soon on bookshop.org. Links and more can be found on medspaamayhem.com.